watching Let's Chat.
At some point, odds are that you, a member of your family, or one of your neighbors will need a rehabilitation center for a number of different reasons. We're here to talk with Siskin Rehab Center about that. Teresa Dinger is here. Teresa is the Vice President for Patient Access and Marketing. Teresa, good to see you. And Dr. Matthew Ryder, who is the admitting physician and medical director of the Stroke Rehab Program. Dr. Ryder, good to see you.
Thank you. Good
in the interest of full disclosure, those of you who used to work here at Channel 12 years ago may remember this lady, Teresa Dinger.
Yes,
good to see you. You were here
about 29 years ago.
How many?
Yes, 29. I was a baby. I was a baby.
So was I. Anyway, it's good to have you both here. Short, sweet, and simple, in a nutshell, when it comes to rehab, why Siskin?
Why Siskin? We're the largest inpatient rehab hospital in the state of Tennessee. We provide excellent patient care, customer satisfaction, and outcomes for our patients. We provide the full spectrum of care from inpatient rehab to skilled nursing facility to our outpatient continuum of care, as well as a fitness center. So whatever your rehab need is here in Chattanooga, we can give it to you.
You all cover all the bases, essentially, not just when it comes to stroke rehab either. And Teresa, in talking with you over the years, you have always kind of underscored the fact that Siskin doesn't just treat the patient.
Absolutely.
By extension, you treat the family.
Absolutely, absolutely. It's all about the whole family. If someone suffers a life-altering event, everyone suffers, right? So we are there for the whole family. And we want to, as Dr. Ryder said, we care for them while they're at the hospital, but then afterwards we have support groups and other levels of care that we can plug them into.
And it's almost like each individual patient kind of has their own Siskin story, step by step, tailor-made, customized for what they need. It's not a one-size-fits-all.
No, you can go out in the community, and anywhere you go, you're going to meet somebody who knows about Siskin, who, like you said, had a loved one at Siskin who was cared for. Siskin has enjoyed a great reputation in our community, and we're continuing to try and improve that reputation throughout time.
And it seems like you're doing that day after day after day. I personally know a number of individuals who have been treated at Siskin, and all of them, without exception, have said nothing but glowingly positive things. A lot of folks, when you think of rehab, especially as it pertains to strokes and stroke treatment, they tend to think more of the physical aspect of it. I want you all to take a moment and tell me more about the psychological and emotional aspect of rehab.
Sure, absolutely. We treat the whole patient. So yes, they're going through physical and occupational therapy to work on their weakness or their deficits with mobility or their activities of daily living, but we have a robust speech therapy as well as neuropsychology program that help to address the social needs, the psychological needs, the emotional needs of folks who are going through a tragic event, something that they were not planning on having to endure.
Right.
And so we have a great and robust psychology program to help them get through this.
All right, Teresa, let me ask you this. When it's determined that someone needs rehab,
Yes.
stroke-related or not, in a nutshell, what are the steps it takes from when that decision is made until the time they walk in your door?
Yes, so we need to receive a referral. So their physician will say they need rehab, and then we receive the referral. So, but what we want people to know is, if for some reason they can ask for Siskin Hospital. They can absolutely ask. They can insist, as a matter of fact, and that's something that we want people to understand, because you don't think about stroke until you have it, right? But then when you're in that position or you have a loved one, where do you turn? And so we just want people to know that you can absolutely ask, and then the referral will be made, and we will take it from there. Dr. Ryder's a champion at fighting for patients and working with insurance and challenging insurance, right? If they try to deny, he will go toe-to-toe.
Which is a big part of what you do.
It is.
I mean, when you hear stroke, obviously your mind goes in 1,000 different directions, but you don't realize the amount of governmental paperwork and other hassles that you have to put up with, and you folks have specialized folks there who do just that. We hope you will come back and join us here over the coming weeks and talk a little bit more about the dream that Mose and Garrison Siskin had 60, 70 years ago.
Yes.
Becoming a reality, and it has been for ages, and it's just getting better and better with time, thanks to Dr. Matthew Ryder and to Dr. You're an honorary doctor now, to Miss Teresa Dinger. Good to see you both,
Thank
and we'll
you.
talk to you soon.
Thanks, Chip.
Find out more about the great work they are doing at Siskin. They are only a mouse click away. You can find out more about them, siskinrehab.org. That's siskinrehab.org.